BT's Body and Balance is sponsored by Canada Diagnostic Centres, offering MRI, X-ray, and ultrasound services in Calgary and Okotoks.
1 in 7 women will suffer from postpartum depression. Those
Big
are
numbers,
serious stats,
yeah.
and moms who are depressed are not able to take care of their babies properly. But health specialist Leah Sarich is here now with how a simple phone call is having a dramatic effect on these new moms. This is groundbreaking.
It is groundbreaking, and it is amazing, and you know what's happening right here at the University of Calgary. Just another example of the exciting research that we're doing right here at home. So this could potentially change the way we treat women with postpartum depression, because these results are so incredible. So basically what the researchers did is they enrolled women with postpartum depression in what's called a peer phone support program. So what that means is that these depressed moms would get a phone call from another mom who had been depressed and had recovered and is now touching base with them, phoning them in their home.
Wow.
They would get a call once a week for 12 weeks. And what the study found, it's absolutely amazing.
So if another mom is calling a mom every week for 12 weeks, we found that we saw effects after about 4 weeks. Most moms were no longer depressed after 4 weeks. But this is the exciting thing, and I think why the study is getting some attention, is that while 100% of women were depressed when they enrolled, after 7 weeks, only 8% of women were depressed. And at the end of 12 weeks, when the program ended, only 11% were depressed. So really, huge. I don't know if you'd see that kind of effectiveness even with medication.
That's true.
Wow.
Yeah, it's amazing. So we're talking about a 90% cure rate. That is unbelievable. And like Nicole said, she said she's not even sure if medication works that well. And in fact, no, medication works in about 50% of cases.
Wow.
So this is almost double that in terms of success. So it's amazing. Not only that, but it's really easy and cost effective to implement. So it's not a difficult thing to set up. Nicole says they had no trouble recruiting volunteers. So these women are the volunteers, and they volunteer their time, no trouble finding them at all. Because what they found is that the women who have been through this and recovered, they really wanted to turn a bad experience for them into something good and positive for another mom.
Right.
So they really wanted to help and give back. So no problem finding volunteers. Also, it's accessible. And this is so critical for these moms, because when you're depressed, you self-isolate. You don't want to go out into the community and seek help. You're not doing that. You just want to stay at home because you're not in the mood, right? It's not there.
Yeah.
So, and they don't have to be in this case. So the phone call comes to them in their home, and they don't have to do anything. They don't have to get dressed. It's right there, right? So that's amazing. Also, the program is non-stigmatizing. So what this does for these moms is this says, look, you don't have to feel bad, because what happens to these moms is they feel that they're a bad mother.
Right.
When in fact, that's not the case. This is an illness that they're dealing with. And because they're talking to another mom who has been through it and recovered, they're saying, okay, you're not a bad mom. You're not failing as a mother. You're doing just fine. You have an illness. We're going to get you through it, right? So that takes that away from them, which is really important. And it also provides them with hope, because, of course, they're talking to another mom who's been through it and recovered and can say it does get better, and it's beautiful at the end of it, right? So this is incredible. And then the other really critical piece we have to talk about here is that the program reduces the amount of time a mom is depressed, and, of course, that has a huge impact on the baby.
If a mom is not able to respond to her baby in a timely way, do those serve and return relationship things, where baby makes a signal that the baby needs something, and in a normal healthy situation, mom should be able to respond quickly and meet the baby's need. But when a mom is depressed, the time to respond might be delayed. Sometimes she might respond quickly, other times she might not respond at all. And those kind of unpredictable environments make for challenges to babies' developing brains, and we call that the brain architecture. The brain architecture can actually be affected for life.
Wow.
The brain architecture of the baby is affected for life. So this is major. So what that means, if the brain architecture in the baby is affected, so that means it's going to have long-term consequences. So what you're looking at is you're looking at a child that has a greater risk of problems down the road. So problems in school, problems with behavior, problems with attention, like ADHD problems, problems with their own issues with anxiety and depression. So all these things happen if baby is not getting that appropriate treatment from mom and the appropriate care from their mom. So what we need to do is help these moms so that their babies are not put at risk, right? So then if their babies are not put at risk, then they become proper functioning members of community, and then this is a real long-term solution. Doesn't it make sense?
This is incredible.
I know, it's absolutely incredible, and it makes so much sense, and of course, easy to make it happen.
More information on your blog.
On my blog, you bet.
If you know somebody who's affected, or you yourself, please do check this out, breakfasttelevision.ca, for more information. Health specialist